And thank you, Christina, for your testimony. Can you explain the connection or relationship that NARAL Pro-Choice Connecticut has with this bill?
Sure. So NARAL Pro-Choice Connecticut, as you've heard from Liz, who testified earlier, they are supporting this bill. It's one of the things that they talk about on their website, on their Twitter, and their social media accounts. They want it to pass. They are championing it. They've also endorsed a number of elected officials that are also supporting this bill. Jillian Gilchrist is their former executive director, so she's obviously connected to NARAL as well and knows about what they do. And they are a pro-abortion advocacy group, and they have that right to be able to do that, but they're not unbiased. So they are coming from the perspective that pregnancy resource centers are fake clinics in general. So really, they can go on and on about what pregnancy centers say or don't say, but they're fundamentally opposed to pregnancy resource centers. So therefore, it's very hard for any pregnancy center leader to trust them or anyone probably endorsed by them, because they understand that part of what they do is to expose fake clinics. That's part of their tagline: expose fake clinics through fake reviews, like Jeremy Bradley mentioned at the beginning of this long day of testifying, through fake reviews, through going in as spies. And this is part of the abortion wars. And so again, this is not going to end with this bill if this bill gets passed.
Thank you for that answer. NARAL Pro-Choice Connecticut says pregnancy centers delay the time-sensitive health care. Can you comment on this?
Sure. Well, again, that goes back to their perspective. They believe that pregnancy centers are existing to trap women and to coerce them or to convince them to carry a pregnancy to term. They are not truly taking into consideration that as a pro-choice organization, the women who are going to pregnancy centers have made that choice. They have made that choice to go to a pregnancy center. And so what they're calling a delay, another woman might call part of her process. But even aside from back and forth, again, without any facts, even the report, the NARAL report, these are anonymous testimonies. And we talked about why women might be afraid. Okay, but they're still anonymous testimonies. So they cannot be fact-checked by a pregnancy center. So ABC Women's Center, for example, I used to serve at ABC Women's Center as the client service manager. There's an anonymous testimony in that report that does not line up with the records on staff for ABC Women's Center. They take records when women come in, they have them fill out forms. And so if you're going to put an anonymous report, if you're going to say Tara, a 19-year-old woman, came into ABC Women's Center in 2015 for a pregnancy test, even though that's her fake name, you still said 19, you still said 2015, and you still said pregnancy test. So guess what? ABC Women's Center can look through the records and see if there was a 19-year-old girl who came in for a pregnancy center, came into their pregnancy center at 2015 to take a test. And if that's not there, then it's not just like, oh, we're not believing women. It's that your report is anonymous and it doesn't line up. We can't even fact check it fully, but what little information doesn't line up with their records. And so, that's part of what NARAL does. They are engaged in pro-abortion advocacy. Again, that's their decision, but they are attacking pro-life pregnancy resources because they are opposed to their fundamental beliefs. That's never going to change. It'll never be enough for some people, even on this committee, no matter what pregnancy centers do. Make them jump through every single hoop, and it will not be enough because they are opposed to them, fundamentally.
Thank you. If legislation passes, how will it impact the pregnancy centers? If this legislation passes?
Honestly, it's already impacting them. It's already impacting them because now they're having to fight these lies about their intentions. I mean, I'll just give a very simple example. What I saw on social media, it's very simple. I know a local elected official who, African-American guy, he's really great. he was just doing a fundraiser for ABC on social media. It was one of those, Facebook allows you to raise money, and someone had given a donation, and then somebody else jumps into the comment section and tells that person, hey, don't you know these are fake clinics? There's reports that these places are deceiving women and they're manipulating women. And the other person was like, I'm sorry, I didn't know that, and so now I feel bad about giving this donation. And of course, I'm giving an example that cannot be fact checked, but I think the way that it can and already is hurting them is, like some leaders have said before, grants. They're losing grants. They're losing donations. They work with WIC. They work with community health centers. They work with New Horizons domestic violence shelters. They work with these organizations. And what happens if this bill passes and the newspapers are the articles, or the Hartford Courant picks it up and it says, Connecticut pregnancy centers found guilty of deceptive advertising. Well, what are the employees going to do at WIC, at SNAP, at New Horizons domestic violence shelter, at these different places? They're going to have to now question, what do I believe to be true? Now, hopefully, if they have a really good relationship with the centers, they could be able to talk to them about it. But we can't say, because maybe a staff worker does, or maybe her boss believes it, and now there's a confusion where one person on the team believes that the centers are being deceptive and another person does it. And so it hurts their reputation, because again, these are accusations against them, and these are very strong accusations against them. They have fake doctors and fake medical people that wear lab coats. They are lying to women. They exist to manipulate women. If that's released in the press as truth because this bill passes without any complaints from actual clients, what are women supposed to think? I wouldn't want to go to a place like that if I read, pregnancy centers are these real fake clinics, and people are going to trust your decision. All of you, even though there's no clients that have testified against the centers, who's going to know that if they read a Hartford Courant title that says pregnancy centers, SB 835 is passed, pregnancy centers found guilty of deceptive advertising? The average woman who's just, she's trying to figure out what she's going to do with her pregnancy, and, it's a pandemic and there's so much going on, and she reads that, now automatically she might think, okay, a pregnancy center is deceptive. They've been found guilty of deceptive advertising. And who's there to tell them, oh, not all centers? It's because no one on this entire committee has ever said it's only this center, it's only that center, but it's not these centers. So the implication is that it's all centers. Otherwise, there wouldn't be multiple pregnancy center leaders here, year after year after year, fighting this legislation. If they didn't feel like all of them were going to be impacted by this, if they didn't feel like all of their reputations were on the line, they wouldn't be wasting their time. I mean, I don't think it's a waste, because this is part of the process of democracy, but still, it is insulting. It is so insulting to say this is only going to affect certain centers when you recognize that multiple leaders are here because NARAL Pro-Choice Connecticut says on their website that they're all fake clinics, and some people who are endorsed by NARAL, fight for that, and it's just really, it's really sad. All we can do with is facts. All we can do with is facts. We can't go back. Abortion wars have been happening since 1973. 1973. They're not going to stop anytime soon. Pro-life versus pro-choice. Pro-lifers think one thing about Planned Parenthood. Pro-choicers think one thing about pregnancy centers. That's not changing. Where are the women? Where are the women who've been hurt?
Ms. Bennett, can I just ask you, because there's other people in line wanting to ask you questions. So I want to make sure they get to ask them, but I also want to make sure that Representative Dauphinais if she has any other questions.
I just had one more, and thank you. I appreciate that, Senator. This bill is supported by pro-choice groups and organizations, and it's focused on the advertising and speech of pro-life organizations. As we seek to understand what deceptive language speech advertising is there anything important we should know about the differences in which these two groups view the issue at hand? And that would be my final question.
Yes, I would say that, again, it goes back to the overall differences between pro-life and a pro-choice mindset. So a perfect example would be Liz, what she just said. She continued to say anti-choice, anti-choice. Pro-lifers don't refer to themselves as anti-choice. And so even if she was doing advertising, through NARAL to say, this is an anti-choice center, a pro-lifer would feel that that's deceptive. A pro-lifer would say, your advertisement through NARAL is deceptive because I'm not anti-choice, I am pro-life. So that's, one example. And again, the women I mentioned in my testimony, what is a delay, and where's the room for a woman having a process to talk about, her pregnancy with someone? So it's just, there's two different worldviews and they are colliding. And that's why it's so scary, because let's be real, we are in a very pro-choice state. We don't have parental notification laws. We do not have mandatory ultrasound laws. We don't have parental consent laws, waiting periods. We have Medicaid paying for abortion on the state level, although it doesn't on the national level because of the Hyde Amendment. So we're in a very accessible state for abortion. And so the people who are in power, the elected officials, many of them are pro-choice. So therefore, it's scary for pregnancy centers to know that they have a completely different worldview, and they'll be using that worldview to determine what is deceptive. Pro-choice people will be able to look at pro-lifers' websites and say, I think this is deceptive. And they wonder, will it be because of that bias, or will it be because of a fact?